Hi, it's Christina with the Sisyphean Journal. Today's July 3rd, and we're looking at another one of those typical pre-legalization abortions. Most abortions prior to legalization were performed by doctors and under pretty much the same circumstances that they would have been performed under had the abortion been legal. In other words, the same instruments, the same location, the same medications. The only thing that was different was the legal status. So we're going to look at a case back in 1929. And remember, this is before antibiotics. So Dorothy was 19 years old and lived with her parents in Tomah, Wisconsin. She was a very active student and had just graduated from high school in June of 1929. She was planning to take a job with the government in Washington. Now, in early June, Dorothy went to her mother with the news that she was pregnant, that she'd missed 2 periods. On June 14th, she was examined by Dr. Winter, who I assume was a family doctor, and he verified that she was pregnant. So on June 15th or 16th, Dorothy's mother brought her to Dr. Walter B. Parke in Camp Douglas, Wisconsin, to arrange for an abortion. He examined her and agreed to a price of $150. Dorothy's mother thought this was expensive, but Parke assured her that he was competent and that this was his usual fee. Dorothy's mother agreed and made plans to return for the actual abortion at a later date. The trip was delayed until June 19th due to inclement weather, and Dorothy's parents wanted to remain at Dr. Parke's home while he did the abortion, but he requested that they leave. They offered to stay at a hotel in Camp Douglas, but he just reassured them everything's going to be fine. He'll do the abortion in the morning. He took their $150 in cash and sent them on their way. Now, other than having had a sore throat about 2 weeks prior to the abortion, Dorothy was in apparent good health when her parents brought her to Parke. Now, the next day, Dorothy's mother went and fetched her daughter home. Dorothy seemed well, but she went to bed. That evening, she was suffering chills, and she continued to be ill, so a few days later, her parents called Dr. Parke and told him about Dorothy's condition. He came to their home and brought instruments with him, which he sterilized by boiling. He then performed a procedure to clear out Dorothy's uterus. Parke came to the home on at least 2 other occasions. On June 25th, he found her condition to be serious, and he wanted to return to Camp Douglas and get some medicine for her. Dorothy's parents wanted to call in another doctor, but Parke told them to wait until after his return. But after he left, Dorothy's parents went ahead and called Dr. Winter. He found Dorothy delirious with a 105-degree fever, and he suspected an abortion. And while Dr. Winter was still there looking after Dorothy, Dr. Parke returned to the house. Parke went to Dr. Winter's house on the 25th to ask after Dorothy and told him he'd been very careful and couldn't understand how Dorothy could possibly have an infection. Under Dr. Winter's care, Dorothy seemed to improve, but she developed pneumonia and died on July 3rd. An autopsy was performed by Dr. Winter and a Dr. Beebe, or Beebe, B-E-E-B-E. They found an enlarged uterus and dilated cervix in keeping with a recent pregnancy and abortion. They found signs of infection and instrumentation. Dorothy's reproductive organs were sent to a pathologist who found necrotic tissue and concluded that sepsis had started in Dorothy's uterus and eventually brought on the fatal pneumonia. Dr. Parke went to the Schultz family house after Dorothy's death to express his sympathy, refund the $150 abortion fee, and pay them an additional $850. Parke testified in his own behalf at his trial, saying that the first visit to his office had been on or about June 8th. He said he'd not examined Dorothy at that time, but agreed to examine her if she was pregnant and see if she could safely give birth. He said he'd asked for $150 in case he had to hospitalize her, perform tests, or consult with other doctors, but he said that, after keeping Dorothy in his home overnight, he sent her home without performing any tests. He also said that when Dorothy's parents brought her to his home on the 19th, she'd already attempted to perform an abortion on herself, and he'd only been treating her, providing aftercare. Parke was convicted of second-degree manslaughter in Dorothy's death and sentenced to a term of 4 to 6 years, and his conviction was upheld. According to his find-a-grave memorial, he died in 1933 at the age of 61 or 62. So again, we have a typical pre-legalization death, which is she went to a doctor and got aftercare from a doctor, and she died anyway. And I don't understand why all surgery has risks can't apply to Dorothy.